Staying with the Monday Report, we start this conversation. Remember, we'd like to hear from you. What kind of message would you like to hear to understand that COVID-19 is on the rise in the country? How should the messaging change in your view? Use the hashtag Monday Report at Trevor Mbija at Citizen TV Kenya. We'll sample some of your views in this broadcast. I see here, Grace Toroitich says, first, can they stop the so-called reggae, then talk to us? Doctors are on strike just because of the delayed salary while they are busy singing about BBI. Trevor, personally, I am tired with this Kenya. That's from Grace Toroitich there. Let me introduce my guest, Dr. Chibanzi Mwachonda. Yes, that's Dr. KMPDU Secretary General. Thank you so much for making time for us. So before we get into the COVID-19 situation, Dr. Chibanzi, the services in public health facilities are now at a standstill. I'd like to hear your views on this. Is this the right time, considering we're dealing with a virus that is what people are calling a second wave?
Thank you, Trevor, for having me. The first and foremost thing to say is that when we all had the pandemic or COVID-19 declared in our country, everyone was looking up to the frontline healthcare workers as the soldiers of this war. And there was a lot of effort and support that was coming through. This support, unfortunately, at this point looks to have waned, and more specifically from the people charged in government to ensure that healthcare workers are well supported. What has resulted is that now we have a divide. The political leadership of the country is on a different agenda, and the healthcare workers are still on the agenda of COVID. And so resources that are supposed to support healthcare workers at this point are no longer being availed as they were earlier on in March, April, and May. So what you're seeing is healthcare workers who are very frustrated, who wake up to a situation that is worsening day by day. They lack, one, comprehensive medical insurance. Two, they have been receiving salaries that are very much delayed. I can still tell you up until now, several of the counties are yet to pay salaries of September and October. And now we're in November. Others up to 3-4 months delays in salaries. Third thing is that you're seeing that even the efforts to provide PPEs for the healthcare workers and the doctors on the ground is a big problem. But specifically now in Nairobi, remember with the transfer of the function of health from Nairobi City Government to then the Nairobi Metropolitan Services, there's been this conflict throughout since it was formed. And what you're seeing here is that you're having the doctors and the other healthcare workers, more specifically for the doctors now, I'd say, is that they do not have a medical cover as we speak. And this cover was in the return to work formula that was signed just in the month of August when there was that industrial action that was taken. And that is the bone of contention, because I know even one of the officials from Nairobi Metropolitan Services is currently sick and down with COVID, and they actually are not able to take care of themselves. So that is how dire the situation is for the healthcare workers. And so it has gotten to a point where healthcare workers, apart from the frustration, are very fast moving to a point of self-preservation. And the conversations that are happening, especially since Friday, when we lost the doctor, the senior doctor, Dr. Lushula, sadly, in Busia, is that all doctors now are moving towards, let us now go back home and just stay home, because they're seeing they do not have support from government and from the political players. And the support from the political players is very simple. I think we'll get into that discussion.
Let's just get into it now, because when you say that doctors are considering downing their tools all over the country, that could portend a deadly crisis.
Yes, Trevor, and I'll tell you, we are seeing more and more of the super spreader events. Because how does the virus spread? How does this disease spread? Unlike malaria and like HIV, this disease spreads simply by, one, talking to one another, two, being in a position where we are all crowded, and the heightened political activity. These political gatherings, once the politicians have left, and you had all these people gathering from different places, having interacted with different people, a substantial number of them contract COVID. Where do these people who contract COVID go to? They go to the healthcare facilities to seek healthcare services. So who are we overburdening in all this it's the healthcare workers. The doctors, right now we are running out of ICU space. That one is a known fact. And just today I was just going through all the forums from the 47 counties where we have doctors, and in our larger forums where we have the doctors. The cry is that, one, we are stretched, we are tired. There are those who've worked 24 hours round the clock. They're not getting enough offs because there is also a shortage. So all this strain is coming onto the health workforce. No matter the activities, even the public apathy that they have right now, we are not seeing people putting on their masks. People are saying COVID is gone. Yeah. But unfortunately, even as you say COVID is gone, the disease is still here with us. Yeah. And that effect is being felt more by the healthcare workers in the hospitals.
So when are we likely to see the doctors downing the tools? Because that is a big concern.
Trevor, it's a consultation that is ongoing now. It just started today. Yeah. We had our advisory council on Saturday. We deliberated on a number of issues, and one of the issues was all this issue of infections amongst healthcare workers, the lack of support on healthcare workers. And I can tell you this conversation beginning today, we'll be able to give a direction very soon, because it's not right that healthcare workers are being put in a corner where they have to take the burden of the entire country with minimal support.
But the timing, Chibanzi, there's a pandemic, there's a crisis, there's a increase in infections now.
Timing is not only for the doctors, timing is equally for the government and the public. Doctors are not special. Doctors equally need that support. And if they feel they do not get that support, and the more and I can tell you, Trevor, if one doctor this week dies, be rest assured, the response you're going to get from the doctors will be, we are downing our tools. We've had enough.
What would you like to see, Dr. Chibanzi? Because this is concerning to Kenyans in general. The politicians you're talking about can easily do without the services of the local doctors.
True.
But the common mwananchi is the one who's going to hurt. What would you like to see?
Politicians are elected by the local mwananchi, and the local mwananchi goes to their politician to seek help on these services. What we like to see, and we've made this clear, we actually put a memorandum to the 5th Extraordinary Summit in July, and we outlined all that needed to be done for the doctors and the healthcare workers in general. Medical cover, comprehensive medical cover, that if a doctor gets COVID today, then they do not have to spend out of pocket. 2, the issue of provision of quality, standard, and adequate personal protective equipment, not just in the COVID-19 designated facilities, but in all facilities, level 2, level 3. We are at a position of community spread. It is widespread. Patients are coming to facilities with what we call atypical presentations. Yeah. Not your usual cough. They have myriad of symptoms. And you test for COVID, it's COVID. So that's the second thing. Third thing, there is the COVID-19 emergency allowance that was awarded for 3 months only. Yeah. It was paid for the month of May, April, June. It was paid in July. August, September, October, we are now in November, the 4th month. That allowance has not been paid to healthcare workers. And what is coming out quite clearly is that no one is willing to put the resources to support the healthcare workers and the doctors in general. That is a simple incentive and motivation for healthcare workers who are really strained as we speak. Apart from medical insurance cover, simple things as timely payment of salaries by county governments. Because we are stretching healthcare workers and the doctors financially. This financial strain is having a turmoil and an effect on our workforce that we really are saying is the front line. Yeah. So all this frustration, I wouldn't want to repeat that word, but all this frustration just shows that it's contempt for us. Okay. And we can no longer accept that.
Based on the numbers that you have, how many healthcare workers have succumbed to the virus so far, and how many have been hospitalized?
We are speaking around over 20 who've died as of end of last week. Yeah. And a good number of them, depending on the symptomatology, And I'll say that the thing that has really helped our country is that our doctor population is largely the youth. The doctors we have in the country, up to 85% of them are within the younger age group, up until their 40s. And then you have the 15%, 10 to 15% who are older, who are vulnerable. So that has led to a situation where most of the doctors who've gotten COVID have not developed severe disease. Most have been mild to moderate disease. That is what has helped us. Unlike other countries in Europe and the US, where we saw it really ravaged healthcare workers. But what is saddening now is that we are also experiencing reinfection amongst the same doctors.
So there also how many of them are in hospital now, by your estimates?
I think I wouldn't want to say, because it's a very fluid situation. I wasn't able to check right now before I came here, but I know as of the weekend we had 2 or 3 who were actually in ICU.
But as healthcare workers, what are you going to achieve with this strike? Because this is new information you just brought to us, that the doctors are considering downing their tools all over the country because they seem to be not getting support. How do you see this panning out? So you down your tools, people die in their numbers, then what?
So who should die? The healthcare workers, the doctors on the front line, or the public? And that's what I'm telling you. You're putting us as your healthcare providers in a corner where it will have to be survival. And no doctor is going to sacrifice their lives for a country that does not want to equally take care of its doctors and healthcare workers. That message is very simple, I think very straightforward. If we do opt out, it means we just want to survive. We are tired of the frustration. It's as simple as that.
But have you tried other channels of negotiation?
Trevor,
minimum
I've told you,
you can take something with the Ministry of Health.
I've told you since April. We've given direction. We have done memorandums. We've gone to the Senate. I don't think there's any arm of government that is not aware of the demands that healthcare workers have put forth. I just told you we did a memorandum to the 5th Extraordinary Summit in July, a memorandum to Senate, and even the Senate report on COVID-19 preparedness in the country that was presented on the floor of the House had recommendations on what healthcare workers needed done for them to continue this fight of COVID-19. So at this point, there is nothing new and nothing that is not known to anyone in government to make sure that healthcare workers are protected and are given the ultimate support for them to offer service. It is very simple and straightforward.
Dennis Ngeno here on Twitter is wondering, what would you like the doctors to do during the pandemic? Some questions politicians should be asked and not medical professionals and any other professions. Put them squarely to political and policy framers. Well, until the strike comes, that's when we will see the difference. Nugi Live says, when will we accept to start living with the virus and stop treating it as a new disease? Why are there no adverts on how to live with the virus, how to go to work, school, markets, general do's and don'ts? Is it time to change the messaging of COVID-19, Dr. Chibanzi? And what should that change look like?
Thank you. The reason why everyone in the first phase and in the first few months of COVID in our country was adhering to the guidelines was because of fear. Nothing else. That fear is what led to the behavior change that we saw, that people started washing their hands, people are putting on their masks and adhering and following up on the COVID updates. It has been here with us. It is going to be here with us. So basically, what does that mean? It means that now for us to effect the behavior change, the messaging has got to change. And not just the messaging, the actions towards adhering to the protocols equally need to be one that show an example for the public. And then thirdly, remember, COVID is also an economic crisis. So people are tired, people are hungry, people need to live. So with that in mind, it means that someone would rather go out there and get money for food as opposed to get money to buy a mask. So I think it's about time that the government equally looked into how to provide masks, at least for the vulnerable within the communities.
Okay. Yes. So, Dr. You know, for me, I'm still surprised about that whole issue of going on strike. But there's a meeting on Wednesday between the president and the county chiefs. What kind of messaging and measures would you like deployed right now?
Okay.
Yeah.
The meeting on Wednesday is meant to discuss and assess the situation.
Yeah.
Let us also be alive to the fact that, yes, we have reopened our economy to a larger extent. Most activities are back to normal. I think the only restrictive measure as we speak right now is the curfew. And so the first thing is to ensure that we reduce and we stop all these super spreader events, all these political gatherings on mass,
yeah,
burials that have large number of people. Any event that is bringing more than 100 people is now putting everyone at risk. That's the first thing. I know there's a discussion of containing and restriction of movement in the counties across the country. At this point, we don't think it will have any major effect. The disease is widespread. It is in each and every county. So even if you spread, even if you stop the movement, what is going to happen? You stop movement, you still allow gatherings, it is still spreading within the community. It doesn't matter if it's in a localized county or in which other
So
county.
A lockdown wouldn't really help.
It will not be of any help at this point, in our opinion. It's not going to be important. Let us enforce wearing of masks as a very restrictive measure. Let us make sure that we provide masks for those who cannot afford the masks. And the messaging has to change. Let us involve all the way down to the village administrators, the chiefs, to have this discussion of ensuring that everyone is protected.
And what about the bars and restaurants?
Bars and restaurants, unfortunately, have also fallen into that super spreader event. And a good example is what happened in the UK last month. They had to close down their bars and restaurants. Sadly, because, and I say it's sad because we know that there are people who depend on these businesses to survive, but the simple act of removing your mask, sitting next to the next person, and then you're sitting together in a crowd and you mingle there for periods is a very big risk factor. So that one is something that will have to be now relooked into. Yeah.
So at this point, now that you say a lockdown won't really help, we just need to stop the super spreader events, how then do we get the true picture of the infections now? Will mass testing help, or how do we go forward?
We cannot say we'll do mass testing. We can only do targeted testing. But what is more important is to strengthen our contact tracing. It has been weak over the past couple of months. It has to go down all the way to the village level where whoever came into contact is traced. And then contact tracing in this context, Nairobi, Mombasa, the major cities that we're having influx of travelers, foreign travelers, a good number of countries in Europe, in Canada, in the US. If you get into that country, regardless of your COVID test, you have to undergo quarantine for 14 days. And in the Gulf states now, recently as of last week, what they've done is you all land, you're all tested, and if one person tests positive, then all those passengers have to go on quarantine. Because equally, with foreign travel, we are still at risk.
And in hindsight, do you think then the home-based care was a good idea?
Home-based care was a good idea because our healthcare system does not have the capacity to admit everyone who turns COVID-19 positive. Up to 80%, 85% are either symptomatic or mild disease. What has failed in the home-based care is that if you as Trevor at home develops symptoms that require emergency treatment, how do you get access to a healthcare facility in the shortest time possible? And if I asked the same question to you, I'm sure you'll tell me in your home right now, if you develop difficulties in breathing and you had COVID, who would you call?
I'd probably call you because I have your number.
Precisely. You see, of which a healthcare system means that there is a number you can call, an ambulance can arrive in your location within 5 to 10 minutes. And in those 5-10 minutes, the emergency responders are able to quickly resuscitate or come up with measures to ensure that you're protected, and then you're transported to a healthcare facility. That strategy is lacking. And that is why in one of our memoranda we put that it was time that the country considered what you call a national ambulance service, both county and national level, where you have access to an ambulance that is well equipped, not just an ambulance that is a vehicle, well equipped and with the right personnel trained for emergency care, so that you can reach to those who are in home-based care quickly.
When you table such proposals, and they sound very reasonable even to any ordinary person who's listening, what kind of response do you get? Noted.
These are things that will be considered.
That's it. No action from there.
Action takes time. So if I'm telling you these are proposals put forth, and up until now, the discussions are ongoing, but you're not hearing of any initiatives to put in place action such as this. There's a lag somewhere.
And Hami Medley here is asking, how has the reopening of schools affected the spike of COVID-19?
It was already in the community. Of course, with schools reopening, you had travel across the country. But we are not the only country in the world who's reopened schools and seen infections, because this infection is not just in schools, it's across the communities and it's in the society. So it was something that was expected to happen. Unless we had no COVID case at all, then we would not expect infections in the schools. But for as long as we have infections in the schools, and where you even have the teachers not living in the schools, they still go out, where you still have students going back home and interacting, that was expected. The only thing is to make sure that for the schools, whoever turns positive, there is a very proper way of monitoring them. And for those who need urgent medical care, need admission, then there are facilities around the schools that can admit these. And thirdly, to ensure that healthcare personnel that are needed are also available, because we are really stretched. We have an acute shortage of healthcare workers in this country.
And Dr. Jibanzi, finally from me, is there any bare minimum that can be done to avert the nationwide doctors' strike?
Because we have put forth everything that is required to be done, the bare minimum is those memoranda that we've put forth. They have all the information, they have the recommendations, and that should be implemented. Medical cover at this point, even NHIF should cover the healthcare workers. Because if NHIF, which is the primary provider of insurance for all doctors in public service, is not offering treatment for COVID, insurance companies, private insurance companies, are not offering treatment for COVID, what does that mean for the healthcare worker? They're exposed.
Okay. And a boy Colorado here is asking, does traveling in a matatu make me risk getting coronavirus?
Have your mask on in whichever vehicle you're in, be the matatu, be an Uber, be a taxi. Have your mask on. I think matatus are still required to operate within a certain number of and accommodate a certain number of passengers. And yes, the bare minimum I've now remembered, apart from all this, not remembered actually, I was waiting for it. The bare minimum, that Health Service Commission has put forth, needs to be a constitutional commission, and that commission will address most of the healthcare workers. Because all these memoranda, all these recommendations we've put forth require multiple players to come on board. But if it was one body that was handling all this, if it is to pay salaries on time because they're getting the financing directly from the exchequer, comprehensive insurance scheme for all healthcare workers, it streamlines everything. So that Health Service Commission, as a constitutional commission, is what will sort out and appease the healthcare workers as we speak today.
Okay. Isaac Mudusi says, I can't imagine doctors going on strike. Lives will be lost and they will be responsible on Judgment Day.
We are all responsible on Judgment Day, but even as you speak about Judgment Day, it's judgment. It means we are all going to be judged, and that responsibility might fall on someone else and not the doctor. Whoever is supposed to take care of the doctor.
Kevo Wood Adori is saying, ask the doctor about his take about the testing which has been going on. Is it helpful?
Testing is and will remain helpful, because it is the only way that you know, or I know I am positive, and because of that I need to isolate and stay away from everyone else so that I do not continue spreading the disease and increasing the disease burden in the country.
Yeah. You had mentioned reinfection, right? Have you seen this very frequently? Because there was research that shows that immunity lingers for a while, especially those who've been infected before.
The research was immunity lingers for up to 3 months, 6 weeks. But I know a number of my colleagues who've been reinfected, confirmed positive again after like a 3 months period of no illness, several negative tests, because you're still working in a high-risk environment, you test positive again. These are things we've seen.
Is it more severe the second time around?
Depends still on the immune system of the individual. It's very much dependent on the individual's immune system.
Buonarizo says, I totally disagree with the doctari. What I know is that they took oaths of putting our health and life first and not their stomachs. God is watching and seeing them, and every life lost because of their ignorance and greed will come back to haunt them.
Can I respond to that?
Yes.
And I'll respond to this analogy. If the country today was being attacked, and our soldiers who were supposed to protect us were sent to the battleground with no bullets, no guns, what would that mean? It would mean they cannot protect us. And it would mean that they go die on the front line for the sake of a country without the requisite tools and weapons. That's the same situation with the doctors. So the issue of greed, the issue of an oath, yes, you take an oath, but equally, you do not provide this service in a vacuum. The actors, the government is supposed to protect its doctors and healthcare workers. So if the government fails in that respect, then there's no reason why the doctors should continue. It's as simple as that.
Weekly for Mondi says, what will be the implication of restricting the movement of those who have tested positive to COVID-19 to other counties, especially if his or her home county's health facility has already been overwhelmed, as alluded by CS Kagwe?
I think that his restricting movement of someone who's tested positive is good until they're cleared. By cleared, it means they've done their 10 to 14 days of quarantine, the symptoms are no longer present, and they've done a test where required, and the test gives them now the clearance, or the absence of symptoms after that 14-day period gives them the clearance. But moving around while you're tested positive is putting everyone at risk, and is actually sabotaging the efforts of everyone who's on the front line trying to combat the disease.
Okay. So there's another one here, Ki Cheza. Says, for how long do the doctors foresee us dealing with the virus, and what are we waiting for if we aren't making the cure or vaccine?
Vaccine is an effort, and the year is ending now. So by next year, we should have the vaccines out. There's research that is ongoing, a lot of research in that, and there's quite a lot of progress on that front, because the vaccine is supposed to be preventive. But the most effective preventive way right now is just adhering to the basic measures. Put on your masks, physical distancing, wash your hands, and limit travel to essential travel, and avoiding large gatherings. Those are the essential preventive measures.
Right. Yeah. Grace Toroitich is wondering, is it right to say that the country is facing a second wave of the pandemic?
Rightfully so at this point in time. It's debatable, but rightfully so. We've seen a surge in infections. The whole month, October is the month that we've recorded the highest number of infections, highest number of mortalities, and even highest number of infections amongst the healthcare workers. Yeah.
And Mwalimu William Mwamburi, he says he's from Watamu. Ask the doctor if swimming in the ocean can be a sanitizer. He has had people saying that around him.
COVID-19 is a virus. swimming does not get the virus away. Yeah, you can go ahead and swim in the ocean, but it's not something that... And I know those are the myths, Trevor, that are going... There are so many myths, depending on the region, depending on the village, depending on the community. So many myths. But the reality is it's a virus, and another virus I'd use that perhaps is easy and has had so many myths throughout its lifespan up until now is HIV. There have been so many myths that if you do A, B, C, and D, you will not, HIV will not be with you, or rather you won't get HIV. But the virus is there.
Okay. Kipleting Manuela says our health workers should be given enough support. They deserve payment of salaries on time, improved working conditions, promotions, medical cover, and PPEs. So-called reggae must stop for the moment. Let's see another one here by Edwin Nyakweba. Says nurses and doctors are tired. The politicians and citizens are misbehaving. HCWs are humans too. They have done their best. No matter the timing, I support them 100% to strike. We can't expect them to be serious while everyone else is joking. Okay? Let's see another one here. See if we can... Pavel says safety starts with you. Doctors need to be protected first before they take care of the rest. Let's see another one here. Ochogia says some unions decided to play politics when they heard that money was available for frontline workers. Today, all healthcare workers continue to face equal risks across board. It's a big shame. And let's see, Hami Medley says, how has the reopening of schools affected the spike? We've spoken about that. Let's see another one here from Gibson Amenya. Says, unity of the country is what we need now with COVID-19 pandemic. Many families are in distress, and a decisive referendum campaigns may lead to chaos and even unrest. Let's see if I can squeeze in a last one here. Patrick Chiriba says, I think a lockdown is not the best solution. We were on lockdown for several months and cases were still being reported. Now we've reopened and we're still reporting new cases. People are living out here, struggling to make a living, so a lockdown won't be a good thing. Finally, Raymond Matata says, to contain COVID-19, the president and Raila must stop the BBI campaigns. Ruto must stop the 2022 campaigns too. It is that simple. BBI and 2022 are not a priority right now. That's where we leave it for now. Dr. Mochonda Chibanzi, Secretary General, Kenya Medical Practitioners and Dentists Union, thank you so much for making time. I hope you'll come back next time with better news in saying that it has been resolved and therefore there's no nationwide doctors' strike.
Thank you, Trevor. We hope so too. And doctors' lives, healthcare workers' lives right now are very important because those are the people who will treat anyone who gets sick.
Absolutely. And we'll continue inviting you here to talk about these issues and see how it turns out. Thank you so much. That has been the Monday Report Town Hall session. My name is Trevor Ombija. Always a pleasure having you with us. Bye for now.